Mental Status Examination or MSE. Many of us intuitively perform many parts of the MSE every time when we interact with others. For example, if you are talking to a friend and they don't seem smiling or talkative as usual, then you may interpret that your friend's mood is being a little low. On the other hand, if someone is talking really fast, loudly, and with a smile on their face, then you may interpret that they are excited about something and their mood is up. So the mental status examination is a structured assessment of the patient's behavioral and cognitive function. It is a total expression of various components. And today we will be looking into the appearance and behavior component. Appearance. General appearance. Too thin or obese? Do they seem old or well preserved? Or any stigmata of physical illness? Then manner of dress. The clothes appropriate to the weather and circumstances. Then dressed excessive formally or over flamboyantly or sexually provocatively, and whether the clothes are put on properly with shoes, socks, etc. Then the buttons are done correctly or not. Do they carry any strange objects? All these things are observed. The poor self-care may indicate decompensation in patient with mental illness. The bizarre or eccentric clothing may be an indicator of schizophrenia or acute mania. Evidence of self-neglect. The following things are observed. Whether the self-care is lower than the normal standard, then the personal hygiene, any malodorous or unshaven or messy hair, then do they smell alcohol? Do they have any evidence of injury or self-harm? Any evidence of intravenous drug use, etc. are observed. Then demeanor. Whether the patient is relaxed, engaged, or differential, or angry, hostile, and confrontational, is the atmosphere threatening, and a level of eye contact, whether reduced or inappropriately intense. All these things are observed. Behavior. Hyperactivity. It refers to an increase in purposeful, goal-oriented activity. It might include excessive cleaning or excessive talking. The significance may be related to anxiety or mania. Psychomotor agitation. It refers to purposeless, goalless activity that the patient may be displaying. The causes of psychomotor agitation may be anxiety disorder, mood disorder, depression, bipolar affective disorder, schizophrenia, drug intoxication, withdrawal, delirium, dementia, etc. The psychomotor signs include restlessness, fidgetiness, inability to settle in chair, and need to pace, etc. Psychomotor retardation. It includes deficient posture, paucity of movement, slow response, etc. In psychomotor retardation, look for reduced movement, speech, and thinking. The causes of the psychomotor retardation may be depression, frontal lobe pathology, dementia, hypothyroidism, etc. Stupor. It is a state that lies somewhere between full awareness and coma. The signs of stupor includes mutism, immobility, unresponsiveness to stimuli, disturbances in eating, drinking, defecating and passing urine, then catalepsy. That is the maintenance of an awkward posture or position. The causes of stupor may be catatonia, depression, schizophrenia, stroke, depressive stupor, and the organic pathology include cerebral or brainstem lesions. Abnormal movements or postures, involuntary movements, tremors, tics, lip smacking, akathisia, and a rocking. Rapport with the patient. Check whether the rapport is good, fair, or bad. Does the patient trust you, and do you have a good connection or relationship with the patient? Behavior that is socially inappropriate. It can be overly familiar or sexually forward, then threatening behavior, aggressive, or the patient may look violent. Structured assessment. Appearance and behavior can give you a small sense of how the rest of the psychiatric interview will go. Appearance and behavior of the patient may provide some clues as to their lifestyle, current mental state, and ability to care for themselves. The aim in appearance and behavior domain is to give a clear picture with words. That is, somebody who read your description should feel like to be in the room with the patient. The mental status examination is a structured assessment of the patient's behavioral and cognitive functioning. Among the various components, today we got into the details of appearance and behavior. Rest of the components will be discussed in the coming videos, so please subscribe the channel. Thank you and keep smiling.